You already done it?
Yeah.
Then you're a doctor.
Okay.
See, you're not really a doctor, they say, till you get a license. I don't know why. When you go to school for 6 years, I think you'll be able to practice on the moon. You know, it's such a sick thing. You know, you please, how many instructors is in a college? 100, would you say? You know, how many doctors would you say you come in contact with teaching you? Probably 100 during your 6 years in school, wouldn't you? And you please all of them. And you get a diploma. Then you have to answer to some clown that couldn't pass a test himself because he goes to the book. You know, when I was trying to get a license in Ohio, there was a test question called, let me see, what's that? Was something about sclerosis or something. But it covered 1.5 lines in Boyd's pathology. It's the hardening of the little things that come off the head. Little things, sclerosis or something, I don't know what it was, but when I looked it up in Boyd's pathology, it covered 1.5 lines. Now Boyd's pathology, last time I looked, had about 1,700 pages. This guy went through there and picked one thing that nobody ever heard of. I never had anybody that knew what it was, except him. But it covered 1.5 lines. Tuberous sclerosis was the name of it. Tuberous sclerosis, that was it. It covered 1.5 lines in Boyd pathology. And these are little, like cell that comes off the head. And they get hard. You know, 1.5 lines in Boyd's pathology, and that was worth 20 points. And you needed 75 to pass. So you're down to nothing before you start. But I felt technique in Florida, so don't feel bad. I got 13.3 on technique. Because I didn't know how to adjust a talus. For the life of me, I couldn't remember which vertebra that was on. Talus, what the hell is that? And then I found out it was down in the foot. See? I said, I don't adjust feet. I'd refer that patient out. 0. See, but you know, by state law, the state law is made to protect the public. If you say you'd refer a patient out to somebody else, you're practicing within the state law. If you don't feel you're adequate to do a job, you should get the patient in somebody else's hands. But that ain't the way they think. The way they think is failure. And the bigger mouth you have, the lower score you get. I hold the record. 13.3. Somebody said out of a perfect what? Oh, out of 15. So that's basically what we're doing here. Now you can do a post, and you can put the patient's number in there. You can do all kinds of things. When you do post, you press pound. And then after you do that, it'll tell you what adjustment did you give. Enter your adjustment. Now, I'm not going to go through this with you completely because when we get the instrument here, we'll do one. But let's say that I did the occiput posterior. The machine is set up for the adjustments that are used the most. And the lower the number, that'd be, like, guess what O would be? What do you think O would be, Lori? Yeah. What do you think number 1 would be? Yeah. How about number 2? C2. But now we're going to get into more cervicals, and we don't want to use that. So then 3 means cervical. So third cervical would be what then, Rick Shea? What would third cervical be?
3.
No, 3 is cervical. So what would third cervical be, Lori? Help him. 33. What would fourth cervical be? 34, okay. Dorsals is 5. So what would dorsal 1 be? Huh?
51?
No, it's 4, I mean. Dorsals are 4.
41.
41. Lumbars is 5. Sacrum is 6. Ilium is 7. So if I did, then the second time around, the numbers mean something different. The most important adjustment that I give is the posterior adjustments. So number 1, the second time around, is posterior. Number 2 is left. Number 3 is right. Number 4 is superior. What's number 5, Kenny? I put them in, but I can't remember. I know them by number. I think number 6 is inferior. Okay. So if I adjusted an atlas, ASLP, atlas, ASLP. Because this is posterior, this is anterior, this is superior. That's what 5 is, it's superior. So atlas, anterior, superior, left, and posterior. Occiput, posterior. Third, cervical, right, would be 3, 3, 3. Cervical is 3. Third cervical would be 33, and right is 3. So it'd be 3, 3, 3. But I mean, this is just a matter of learning the keyboard. See, I mean, I know it so well that when I went up there into the listing, I did it, but yet I couldn't sit here and tell you. So, I don't know about the rest of the instruments, but they got the dorsal screwed up on mine. If I want dorsal 10, you would think it'd be star. But star is 11 on mine. 0 is 10. And pound is 12. Is that way on yours too, Kenny? Don't you know?
I don't have an instrument. I have the other.
Oh, okay. You don't have that.
3A or whatever.
Okay, so it is very easy to use. It's a matter of just getting used to it. Adjustment number 1. Okay, this is how we read the patient. We start at the bottom. We start at the sacrum. You don't touch the skin. And you keep moving the instrument so that it's always 90 degrees to the spine. So when you going up in the lumbars, you're this way. When you get in the dorsals, this way. Cervicals, this way. And you notice she's not touching his skin at all. She's going up the spine. You notice how she angles and keeps it a 45-degree angle. See, if you get like this with the instrument, you're going to be reading up there. You have to make sure that that instrument is looking right down. And if you're tipping it too much, you're going to be a vertebra ahead of where you should be. So you try to keep it directly on. Now you notice when she gets up in the hairline, she will part his hair. Now this is a non-contact instrument, but I'd rather see you slightly touch the skin in the hairline than to let hair get under your instrument. Remember that this is nothing more than a thermometer. It's only going to give you what it sees. Now, you should actually give a person a note when he comes in your office. When you come in his office, I want you dressed in something that zips down the back. I want a bra that opens in the back. And I don't ever want you to have a wet head when you come into this office. See, now you're eliminating gowns. I hate gowns. I don't like to put people in gowns except when they're getting x-rayed. People don't like to get undressed by nature. They don't like to mess their hair up and pull their clothes up and have to get undressed all the time. People don't like that. So I try to tell my patients, come in slacks with no girdles, something that zips up the back, with a bra that opens in the back. That way, it's a time-saving thing. You don't have all those gowns to be concerned with, and the patient feels more comfortable. So that's the way we normally do. So you should tell a patient, don't ever come in here right after you shampoo your hair, because if you do, it's wet, and wetness causes evaporation. Evaporation lowers your temperature. See? So if you're getting a real cold swing on a wet head, it's not because the problem, see, keep in mind that when you're reading the spine, whatever's on the skin will affect this instrument 30%. The reading inside is 70%. So it's 70% core, C-O-R-E, temperature, and 30% skin temperature. So if you have a big pimple, or if you have a real bad sunburn, or if you have wet heads, this is going to affect your readings. And you're going to have to interpret them a little bit different. So what you try to do is you try to get rid of any variables that you can. Now some of them you have to learn to live with. But if you have a real cold spot in an area that's sunburned, don't think the sunburn will affect the 70%. If there's a cold spot, relatively speaking, it'll still be there, because everything's relative. See, what would happen in the sunburn area would be this. I'll show you what would happen. If you're in a sunburn area, and let's say we have the same cold spot, but now we're sunburned from here up to here. Your reading's going to come up like this and do this. See? The cold spot is relatively much warmer, but it is still there. Okay. Because you're not going to get sunburned in a streak. One vertebrae is not going to be sunburned. So the body is overall warmed up. The 30% of the skin is giving you a warming of that area in relative to the part that's not sunburned. But if there is a cold spot in the sunburn area, you're still going to find it. Okay? But what would happen on a temperature like this is you would probably have a 10-degree difference from top to bottom, which we hate to see under normal conditions. But a sunburn is not a normal condition. But you have to realize this with your case history. How'd you get this red spot? Well, I sat on the stove. Okay? You know you're going to get a different thing, but the cold spot relatively is still there. Now you notice how she's reading there. Now probably the hardest part of the reading is the next part. People tend not to. And we have a lot of spaces in this tray, Kenny, for you to probably put your stuff. You notice when she's reading his neck, she's going directly in. She's holding his ear out of the way. Too many people are too lazy. They're standing behind the patient. They want to reach around and take readings. Well, remember this. If you're reading the mandible on one side and the mastoid on the other side, you're not going to get the proper reading. The ideal spot is to lift the ear, and then I take the instrument in, and I will balance it off of my thumb, the same thumb that's doing the ear, and I'll pick up a reading. I will not touch the skin. If you touch the skin here, there's a little tube on the end of your instrument that will suck heat into it. Then when you go on the other side, your other side's going to be a half a degree colder or warmer, because you're already going to have the thermistor warmed up from the other ear. So when you pick up the temperature over here, you're going to be about a half a degree warmer, which will think you want to adjust this side. And you really, it's just a technique problem. You know, they have a new instrument out today for reading temperatures on kids. You stick it in the ear, and you can get a temperature within 2 seconds. You know, the ear and the eyeball are the two most stable things. Now, I had a chiropractor at my last seminar. His kid was sick, and he had the ears read like that, and the kid had a temperature of 94.8 in this ear, but in this ear, was only 92.8. Okay? And when he adjusted it, they balanced and came down. So I was going to pick up one of them instruments to see, because if we could read inside the ear, it'd be so much better than what we're doing today. See? Because, you know, a lot of times, here comes a guy in your office. Got the air conditioner on, and it's blowing right on this side of his head. Or he got the window down, and it's blowing on this side. He'll come in, he'll have as much as 2 degrees temperature difference from side to side. On an average person, you hardly ever see a temperature, even when he's subluxated, more than a degree or a degree and 2/10. If you have a person that's reading 4 or 5 degrees difference from Atlas, you done it wrong, or there was some outside interference. Oh yeah, I was driving down a highway and that cold air was blowing right in my face. This side had the heater on over here. See? So you have to remember, this is only a thermometer. It only gives you what it sees, so you have to be careful. Now, my patients bring me all of this stuff. That there cup sings my way, because people say that song is what I am, but I don't do anything but my way. We want a temperature reading within 1 degree from top to bottom, and that perfect temperature is 93.5. Now that's a perfect temperature from 2 to 6 in the afternoon. If you read the same patient from 2 to 6 in the morning, you would find the perfect temperature would be 91.5. So you want a patient's skin temperature to be in the 90s. Now this stuff is all backed up with scientific material. The people who do flotation tanks found out that when you feel that you are in your mother uterus, which is the perfect place to be, the temperature is 93.5. That you can lay in the nude at 93.5 forever and feel perfect. That's because your body temperature is the same as your environment. Now, you know, you go to sleep on the floor at night in a room that's 72 degrees, and you feel very, very comfortable. In fact, if someone throws a blanket on you, you're going to kick it off. Now, the temperature in that house doesn't change a bit, but about 2 o'clock in the morning, you're trying to roll up in the rug because your body temperature is dropped. See? So 93.5, there's a whole book written on this temperature thing. And it was written by those people who did that. That the perfect temperature, your surroundings should be 93.5, is when you feel it in the nude just perfect. See? And we want the left and the right atlas to be exactly the same. Now the thing you look for in readings are patterns. If you have a person that is constantly showing the same type of reading, that person is in severe trouble. Now that doesn't mean they're not going to die in the morning. But I'll tell you what, if you don't get rid of that reading, they're dying. See, people just don't die like this. You know, you hear them say, oh, John was perfect, he was in perfect health, and this morning he dropped dead. Yeah, some irate husband shot him. See, if he dropped dead today, it's because he was dying before. Now, if you could had a movie of his life, you would find out that when he was by himself, he had plenty of complaints, and he just wasn't complaining about it. But when he went up steps, he had trouble breathing. He just couldn't do the things he could. But you start throwing it off as, oh, I'm over 40, I'm over the hill. That's crap. You're not over the hill. See? You just don't die. You die back here. Now, that's not the way life's supposed to be. You should come into this life, and when you come into this life, you come in with the 2 greatest things that the world could ever give you. youth and health. And from then on, it's a battle to maintain that. You know, all you women use them creams and you bathe in this stuff and all that to keep away those wrinkles, you know. Put that stuff on your face at night and put them hairs up in curlers, all these things that you do to stay young. But life should come in with a bounce, and you should just bounce all the way through life. And then, finish. It should not be this crap. It should come in, over, and out. Of course, got two ways you can go, they tell me. So it depends on what you want to do. But patterns are anything that duplicates themselves. Patterns. A pattern of her blouse will be exactly the same. I don't care if it's size 42 or size 3. It would have that lace on the collar. It would have so many buttons. The buttons would be exactly the same. They might be different color. See? But the cut of that would be exactly the same. If we made a sweater like this, it'd be exactly the same. It could be a different color, but it's a pattern. A pattern is anything that's duplicatable. If you have a patient that has a reading like that, and it's strange. You know, the old theory of instrumentation was if you saw a break somewhere, that's where you should adjust. The breaks are very seldom, or the cold spots, whatever you want to call them, are very seldom at the point of adjustment. They're usually at the point of symptom. They work more with the Merrick system. See? If you have stomach trouble, you're likely to have a cold spot in 7th dorsal. If you have heart troubles and lung troubles, you're likely to have cold spots at 1st and 2nd dorsal. If you have sciatica, you're likely to have a cold spot right at the atlas. So you never know. Many times the cold spot will be right at the vertebra you want to adjust, but you do not use that as the criteria to give us particular vertebra and adjustment. Now see, that other reading showed the coldest spots in the cervical spine. The coldest spot on this patient is in the sacroiliac lumbar area. So a pattern, now where I'm different from what I was taught in pattern, see, when I was taught pattern back in the 50s, everybody got a pattern and it's always the same. Well, see, that's when you're working with one vertebra causes all subluxations. I believe that there's more than one subluxation in the body. And I believe that each subluxation would have its own separate and distinct pattern. So when you first look at a brand new patient, a person could have 4 cold spots, let's say. Under the old theory, one vertebra is supposed to clear all that out. And the secret was, we want to make a change. Now, what is a change? See? If this is a pattern, then that's a change, isn't it? Because this one cold spot is totally gone. So under the old days, we would say, enough done. See? Now, this is also a change, isn't it? Now, which change would you rather have, Ken?
Straight line.
I'd rather have that straight line, because now we're down to what I told you, within 1 degree from top to bottom. Now, we have to add something to that. It should be 1 degree from top to bottom, but it should constantly be changing. Do you realize that what you eat can cause changes in patterns? I'll tell you what, if we took readings on you right now, and then let you go down to McDonald's and eat, and come back and took a reading on you, it would not be uncommon for you to have a great big cold spot like that right over stomach area. You know why? Because when you're digesting all that food, the body, see, I can figure the body is like a bunch of soldiers. Now, right now, you're not using as many soldiers as I am. I'm standing up. It takes so many soldiers to hold me up. And I'm talking, I'm going through all kind of movements. That takes more soldiers. So your soldiers, instead of being out on the duty doing that, your soldiers could be digesting food for you, or they could even be repairing some damaged tissue. See, there's so many soldiers allotted for everything. At night, the reason you repair when you're sleeping is because they only need one soldier in each area. You know, you need one soldier down here that wake you up in case you have to go to the bathroom. You don't need a bunch of soldiers there. But yet if you have a kidney problem, they would suck soldiers from other places and concentrate on that. That's the way I look at the body. It's a very, very simple way. See? So, whenever you've eaten something, all the blood got to go to your stomach. So that will make other areas look cold. So it'll take a lot of that heat out of your back and put it over in your stomach so that you will get a cold spot. Do you realize that a chronic irrigation can clear out some patterns? Because they take poisons out of your body. And you take poisons out of your body. Now that doesn't mean I want you to go around giving chronic irrigation, but what I'm trying to show you is different things can change the heat in your body. Okay. So when these people do this stuff, and they say, well, I get results by doing that, they do. But they are what type of results? They are symptomatic results. They're not correcting nothing. See? Now, if you have a big cut on your arm, that cut's going to feel a lot better if you keep it clean and you keep it bandaged compared to the guy who's pouring whiskey on it and putting dirt in it. See? Now, that bandage and that stuff that they put on your arm has nothing to do with healing your arm. But it's given it perfect conditions to heal under. If you constantly are picking at the scab and pouring stuff on it and putting your hand, you know, Burl Pettibone almost died when he was here because he had a little cut on his finger and he went home and mixed up some dog food for his dog. Within hours, he was delirious. He almost died. He got some type of horrible infection. It ate his joint away. Burl has a finger that's like this now. Okay. So, his cut was not healing under proper conditions. Okay. So whenever people give medicine or give chronic irrigations or massage or anything like that, they're stimulating the system. Anything that stimulates the system will have a curative type effect. But it doesn't cure anything, it just relieves. See, so anything you do to this body can make changes. And you can pick these things up. Now, they'll be temporary. Those cold spots will come back unless you really adjust them. Now, see, as I've done this over the years, I found out that I give an adjustment to a person like this and make it change. 2 days later, they come back, the same reading's back. Then you've got to start questioning, how long did that change occur? Did it only last until the patient come out of the office? Did it last for a day? Did it last for 2 days? Did it just come back out of line this morning? Now, if you cannot get rid of that pattern for a lengthy time, the patient is going to stay constantly sick. And they'll go from one symptom to another symptom. The way I look at pattern is